The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome to the Healthy Image Podcast. I'm your host, Veronica.
And I'm your co-host, Stacy.
Today, we're taking you inside the Hill Medical Corporation to talk about their services, locations, partnerships, and how they truly put patients first.
Let's dive in. Okay, Veronica, for people who do not know Hill Medical, who are they?
So Hill Medical is a group of radiologists that provide advanced medical imaging services like MRI, CT, ultrasound, PET, and that helps doctors to be able to diagnose their patients so the patients can receive whatever treatment they need in a quick manner.
So what makes Hill Medical different than other imaging places or other imaging providers?
I would say what sets Hill Medical apart is their combination of advanced technology, their experienced subspecialty radiologists, which means that, there's a radiologist, but then there's a radiologist who specializes in breast imaging or neurology or musculoskeletal imaging. So Hill Medical, we have subspecialized radiologists, which not all places have.
Yeah. So what I'm understanding is that because of that, like a breast exam that you do at Huntington Hill will not be read by a radiologist.
Correct, yeah.
Okay, so that means like whatever body part I'm scanning, there's a doctor that specializes in that.
Yeah.
field. Okay.
And I think another thing that the radiologists from Hill Medical do, just from firsthand experience that I've noticed, is they really want to make sure that the patient is getting the correct scan.
Yeah.
They know based off of all of the, images that they're reading all day long, what exam will show the doctor, the ordering doctor, what
Exactly.
they need to see.
Yeah.
So they'll even go as far as to say, hey, this doctor's ordering a CT with and without. Let's just do a CT with, and it'll show you what you need to see. And it's, less radiation for the patient.
Yeah.
They could essentially just do the CT with and without.
Just do exactly what the paper is ordered.
But they're looking at it and saying, you know what, this is what we need to do to show the doctor what they want to see. And we're going to give the patient less radiation. So it's like they're trying to just make sure that the patient's getting the best thing for the patient and for the referring doctor. And I don't think that happens a lot of places.
Yeah. So what I'm understanding is like for CTs, for example, there is a certain level of radiation that the body can take, right? So when you're saying with and without, does that mean they're going to inject the patient, scan them one time, or no, they scan them without,
right,
and then inject them, but based off of like the qualifications of the radiologist and certain criterias, they will only do it with versus overrating the patient.
Yeah.
Right?
As if doing it only with will show them what they need to see,
Okay.
then they'll suggest doing it with only, so that way the patient's not being scanned twice.
Yeah.
Can you talk a little bit about our partnership with Huntington Health and what that means for patient care?
Of course. Hill Medical actually has a long-standing partnership with Huntington Health, which helps provide seamless, coordinated care from imaging to treatment so patients don't feel lost in the process.
And when you say Huntington Health, is that like Huntington Hospital
Huntington
in Pasadena?
Hospital in Pasadena.
Okay. And also a little fun fact about that is the doctors, the radiologists at Hill Medical read the radiology exams that are done at
The
Huntington Hospital. Yeah.
So if you ever go to the hospital or the ER and have any type of imaging done, it's read by the group of radiologists that work here.
How do your relationships with referring physicians improve patient care?
When the radiologists and the physicians actually can communicate closely and build that relationship, I feel like that leads to more precise imaging, faster ordering, better coordinated care, which ultimately benefits the patient. Like
Mm-hmm.
we had Dr. Mena here recently,
Mm-hmm.
and he does actually research studies, and he spoke about how it's great here at Huntington Hill that there is radiologists that he can call if he saw something on a scan or it's not on the report. There is someone here always to answer the questions.
Mm-hmm. Yeah.
Hmm.
How do these partnerships help patients get faster answers and better care?
Because everyone is communicating and they're connecting, and so then that way once their exam is done, the radiologist reads it in a timely manner and then it goes on to the patient portal. The doctors get the results really quickly, and ultimately it just makes the wait time for patients a lot shorter so they know the diagnosis quickly.
And I think that it kind of goes back to what we were talking about with that partnership. There is our radiologists
Hmm.
know the doctors for Huntington Health, and if there are questions or
Hmm.
comments, anything like that, they can communicate. They
Yeah.
they know each other really well,
Hmm.
and work together to make sure that the patient gets what they need.
The patient gets the best care.
Mm-hmm.
Veronica, can you tell us a little bit more about Huntington Health and the locations that you guys have in the San Gabriel Valley area?
Yeah. So Huntington Hill Breast and Imaging Centers have 5 imaging centers throughout the San Gabriel Valley. We have one in Glendora, West Covina, Arcadia, and 2 in Pasadena.
Mm-hmm.
One of them is actually on the same campus as Huntington Hospital.
Mm-hmm.
The other Pasadena location is, I think, 1.4 miles away from
Yeah.
there. So a lot of convenient locations all
Mm-hmm.
across the 210 freeway there. And I mean, if someone's needing imaging, we can find a spot for you at one
Mm-hmm.
of the 5 locations.
Can you remind me which locations have free parking?
Yes. So our our imaging center in Pasadena on Cordova has free parking.
Mm-hmm.
Arcadia has free parking. They also have a really beautiful view.
Yeah. A very scenic view of
Yeah,
the
what is
San
it?
Gabriel Valley
It's on the
Mountains.
6th floor of the building, and you could be getting a screening
Yeah.
mammogram and looking out at the Santa Anita racetrack there and the foothills. It's
You can
so
see
pretty.
you can see the jockeys doing their little practice
Yeah,
races. Like there's so much to
yeah.
see.
That one has a very beautiful view. But Glendora also has free parking, as well as West Covina. So
Mm-hmm.
the only one that you actually have to pay to park at is our Pasadena location
Mm-hmm.
on Fair Oaks, the one that's on the same campus as the hospital.
Yeah. What type of imaging exams do you guys offer at the centers?
Oh, we have a very wide range of exams we
Mm-hmm.
do. Most common being MRI scans, CT
Mm-hmm.
scans, ultrasound, X-ray. We do 3D screening mammograms.
Mm-hmm.
We also have PET CT scans, bone density scans, and we also do some specialized screenings like heart and lung scans.
Mm-hmm. What type of technology can the patients expect when they come in?
Patients can expect state of the art imaging equipment designed for faster scans, clearer images, and a more comfortable experience overall. We also have AI tools that help with um, scheduling the radiologist reading.
Mm-hmm.
So we have a lot of assistance there where the AI doesn't actually take over,
Mm-hmm.
but it can assist. It might be able to show the radiologist, hey, look in this spot.
Mm-hmm.
The AI will look at that. Then
Yeah.
the radiologist can go in and make the final say.
Mm-hmm. Because then that's mostly used when like there's comparisons, like say like they did the same exam
Mm-hmm.
last year,
Yeah.
then the AI can then differentiate, and like if there's something there, then it might just highlight it, and then still the radiologist is the one that reads it,
Right.
right?
Yeah.
Yeah.
Can't always trust, robots. We need humans too. They're taking over the world. It's scary. But we'll take their help. We just don't want them to take over.
Yeah.
From what you've witnessed, how does
Hmm.
the staff help patients feel calm and less nervous if it's a scan that they're really stressed out about?
Um, from what I've seen at the centers, I can really see that the staff takes time to explain the exam so the patient is aware of what's happening next. Because a lot of times when you think about patients coming in to do an exam, it's probably their first time there, right? You know, the anxiety of finding parking, going to the appointment on time, and then not knowing what to expect, I think creates a lot of anxiety for people. What I have seen is our staff will take the time and actually calm, like, if they notice they're a little anxious, they'll take the extra time to explain things to them. And at the end, once the exam is done, the patient does feel very relieved. And I've seen it firsthand myself when I'm at the centers, when I go visit. I can see that, the staff are taking extra time to explain things. And they always ask, like, if you have any questions, like, please let me know. I hear that a lot. If you have any questions, please let me know. I'm right over here. So I feel like that creates support for patients, especially first-time patients or even frequent flyers. Like, I think that's important to show people that we care.
Yeah. And we do care.
Yeah.
It's not an act.
No, you're not a number,
Right.
to us. Like, you are more than your diagnosis. Like, we really genuinely care.
Yeah. How easy is the patient portal?
Very easy. We have a supportive IT team. You just have to sign up with your email and all the steps are there. And if they have any questions, they can always call IT. And I know the help desk is available.
What would you say to a patient who's anxious about getting imaging done?
I would say it's pretty normal to feel anxious. I mean, doing new things is scary for anyone, right?
Yeah.
Like, just because it's, the first time or the 10th time you've done something, I still think that it's okay. Just realize that you are in good hands here. Imaging is safe, it's non-invasive, and it's designed to help you and your care team get answers. So if you have questions, do not hesitate to ask because your comfort is number one to us.
Yeah. I think that's well said. Well, that wraps up today's episode on the Healthy Image podcast. If there's one thing we hope you take away, it's this. Imaging doesn't have to feel overwhelming. With the right team, the right technology, and a patient-first approach, it can be a smooth and reassuring part of your care. Thank you for spending this time with us, and as always, stay curious, stay engaged, and stay healthy. Bye!